Hi everyone, today we're going to look at how to set up your massage bed and how to do a back massage. So we are looking at deep tissue massage, i.e. Going into the deeper layers of muscle, and if you are a sports massage therapist, this may be useful for you in terms of posture, or you may just like some of the techniques that I'm going to show you. So the first thing we need to look at is how we position our clients. And you'll see here that you want your client to be comfortable, and your draping needs to be such that your client is not too hot or too cold. So for example, because today's a nice summery day, I have used a sheet. I've folded it in half so that it's not too see-through, and also it's not too cool for my client. So I want her to be comfortable basically all the time, and I'm going to ask her if she's comfortable and make sure that she is in a good position for when I do her back massage. Also, you need to make sure that you're using a bolster that's suitable for your client's foot. In other words, you don't want it too high or too low that the toes are crunched on the massage bed. So because my client is smaller in size, I've used a bolster that's a half bolster, and it's very comfortable for her. So the first thing I'm going to do is to maintain contact on her body, make sure she feels safe and relaxed all the time. Sometimes people feel uncomfortable if it's the first time you are massaging them. So we want to just make sure that you don't let your hands leave the body too often or for too long at a time. So I'm just making her feel relaxed by doing a little bit of kneading, and then what I'm going to do is remove this section of the draping, and I'm going to start on her back. So we're going to tuck this in here. Now you're going to need to bring down your client's underwear a little bit so that you can get to the bottom of the back area, into the sacroiliac joint area, and perhaps into the glutes if they need a little bit done further down there. So we're just going to get comfortable. You want the person to be covered here so that nothing is showing from this point below, and we're going to ask the client if it's okay to remove their underwear, and we're then going to use our oil or lotion. So with your oil and lotion, you want to make sure first of all that it's not dripping everywhere. So you'll see I cover mine in a little coat. I personally use a little sock to make sure that it doesn't drip, and if it does drip, it'll go into the material and not ruin their furniture. So we're going to put a little bit of oil on, rub it in. Make sure you use enough so that you're not pulling on the skin, because the last thing we want to do is cause our customers skin irritation, particularly if you're working with somebody who has a little more hair. You don't want to pull the hair, because you can cause folliculitis, which we don't want. That's where each hair follicle can become inflamed and very painful, and actually it's an infection of the hair follicle. Okay, so I've put on my oil. I like to keep my oil nearby in case I need a little bit extra. Then I have it at hand. And actually, it's very important now that I look at my posture. If I'm standing too far away from my massage bed, it can cause me a lot of backache. I don't want to be stretching like this. It's better for me to have my hips closer to the bed. You should be as close as possible with your massage bed at a height of the bottom of your fist. If you were to close your hands like this, with your arms straight, that is the height your bed should be ideally, but a little bit of variation won't hurt you if it's more comfortable for you. I tend to keep my bed very slightly lower so that I can really get on top of my client and get deep into those muscles. So the first thing we're going to look at is a sort of comfortable depth into the muscles, not too hard. I'm using my thumbs to go up the postural muscles on the side of her back into her shoulder area, and I'm using the heel of my palm at the bottom area, And I'm just leaning forward and downward so that she's getting a nice massage covering her entire back and the top of her glutes to begin with. You can also use your thumbs to move down those postural muscles on the sides of the spine. You can use both hands at once like this, just to relax the entire area. And you can see that I avoid touching the spine, I avoid touching the bones, the discs of the spine, and I focus on the muscles. And again, I'm not too far away from her. If I need to get closer to the bottom of her back or the sides of her back, I'll move around the bed. So it's very important that you're leaning into your strokes and moving back with your legs and not your back. The last thing you need is backache or back problems. So we're going to just gently start off and slowly get deeper and deeper into those muscles. Remember to ask your clients, not too often, but remind them that they can tell you if it's too hard, if it's too deep, or if it's too painful. Although deep tissue is deep tissue, you don't want your client to be in absolute agony so that they can't walk the next day. It needs to be comfortable but effective, and everybody needs to be treated as an individual. We don't want to use the same pressure on a smaller person that we would use on a larger person, for example. Okay, so I'm moving down the postural muscles into the sacroiliac area and the glute area, and I'm going to come up now and do a few strokes moving upwards into the trapezius, around the shoulder blades, and you can see I'm using one thumb at a time and leaning into my hand so that it's not hurting me anywhere. This is generally quite relaxing. A lot of people hold their stress up in this area, so this tends to be quite a good technique for me and for my client. For me, because it's quite easy to do and it's not hurting my hands, it doesn't hurt my back. And for my client, because it's a nice sensation when you're moving upwards from the spinal area into the trapezius muscles here. You can move around the shoulder area like this, and then of course you can move around the bed, and we can go up into the neck. So with the neck as well, we try not to go too hard unless your client wants it a bit deeper. The neck is a very sensitive area. You just need to be careful that you don't cause anybody any headaches, because it is quite sensitive, and there's a lot of important things going on in the neck, nerves, blood vessels and things like that. So you just want to make your client feel comfortable, not too deep, not too hard at the beginning, but slowly getting a little bit deeper. Now when I'm doing this, you'll see my back remains pretty straight, and I'm using my body weight to lean into her, rather than standing too far away and having to push with my arms. We don't want to do this kind of thing, but you do want to do this kind of thing. So your arms need to be relatively relaxed, not too bent, not too straight. You need to use your body weight behind your arms so that you are always comfortable. Okay, so we can move around this area here, and just make sure that you're covering the entire back. So I'm doing the bottom, I'm doing the top, I'm doing the middle. You also want to make sure that you're not putting oil or lotion into your client's hair, although they may want a head massage at some point. But what we don't want to do is have them dripping with oil. So I've moved her hair out of the way so that she's comfortable and I'm comfortable, and it's easy for me to work around her. I hope you found this video useful. The next ones will be looking at the legs and how to do massage, some ideas at least, on the hamstrings and the calf muscles. And I'm sure you all have your own ways and your own techniques. This is just some guidance if you're interested. I hope you have enjoyed this video, and please do subscribe if you have, because there's plenty more to come. And if you didn't like it, well, good luck with everything you're doing. I'm sure you're great too, and thanks for watching. See you soon.